Managing diabetes can be a constant challenge, with regular blood sugar monitoring, strict meal plans, and the concern of potential complications. But what if there was a way to improve your blood sugar control? This video explores the top 5 vitamins that have been scientifically shown to help lower blood sugar and enhance overall health for individuals with diabetes. Join us as we uncover these essential nutrients and discover how they can potentially transform your diabetes management journey. 1. Magnesium. Magnesium plays a vital role in over 300 biochemical processes in the body, including glucose metabolism and insulin function, 2 areas often challenging for individuals with diabetes. By supporting enzyme activity in the glucose metabolism cycle, magnesium helps regulate glucose metabolism and promotes better blood sugar control. Additionally, magnesium assists insulin in transporting glucose from the bloodstream into cells, enhancing the body's ability to utilize insulin effectively. Insulin resistance. When magnesium is deficient, the body struggles to utilize insulin effectively, potentially exacerbating insulin resistance. Increased inflammation. Magnesium deficiency can contribute to increased inflammation, which may worsen diabetic complications such as heart disease, nerve damage, and kidney problems. High blood pressure. Magnesium deficiency can lead to elevated blood pressure, putting additional strain on the heart and kidneys, organs that are particularly vulnerable in individuals with diabetes. Improving insulin sensitivity. Research published in Diabetes Care suggests that magnesium supplementation can significantly improve insulin sensitivity, enabling your body to utilize insulin more effectively. Reducing inflammation. Magnesium helps reduce inflammatory factors, thereby protecting your body from diabetes complications, such as cardiovascular disease and nerve damage. Lowering blood pressure. Magnesium helps relax blood vessels, supporting blood pressure regulation and protecting cardiovascular health. Foods rich in magnesium include spinach, almonds, cashews, chia seeds, black beans, and avocado. Magnesium-rich mineral water is also a good option. Magnesium supplements are available in forms that are easily absorbed, such as magnesium citrate and magnesium glycinate. The recommended daily intake is 200 to 400 milligrams. Remember to consult your doctor before taking any supplements, especially if you have kidney disease. Overdosing on magnesium can lead to diarrhea, nausea, or gastrointestinal issues. For individuals with kidney problems, the body may struggle to eliminate excess magnesium, potentially leading to a buildup of magnesium in the blood, magnesium toxicity. Taking magnesium supplements can be a simple yet effective way for people with diabetes to manage their condition and improve their quality of life. Magnesium helps improve blood sugar control by reducing insulin resistance, protecting overall health by reducing inflammation and lowering blood pressure, and supporting cardiovascular health by lowering blood lipids and protecting blood vessels from damage. 2. Vitamin D. Vitamin D plays a crucial role in supporting insulin production and function. It helps the pancreas produce insulin more effectively and enhances the body's sensitivity to insulin, which is essential for blood sugar control. Vitamin D also helps regulate blood sugar metabolism by supporting the function of beta cells in the pancreas, which are responsible for insulin production. Additionally, vitamin D has natural anti-inflammatory properties which can help reduce chronic inflammation, a major risk factor for diabetes complications such as heart disease, nerve damage, and kidney failure. Vitamin D plays a crucial role in supporting insulin production and function. It helps the pancreas produce insulin more effectively and enhances the body's sensitivity to insulin, which is essential for blood sugar control. Vitamin D also helps regulate blood sugar metabolism by supporting the function of beta cells in the pancreas, which are responsible for insulin production. Additionally, vitamin D has natural anti-inflammatory properties, which can help reduce chronic inflammation, a major risk factor for diabetes complications such as heart disease, nerve damage, and kidney failure. Improving insulin sensitivity. Research published in the Journal of Clinical Endocrinology and Metabolism suggests that vitamin D supplementation significantly increases insulin sensitivity, leading to better blood sugar control. Enhancing beta cell function. Vitamin D helps protect and improve the function of beta cells, boosting the pancreas's ability to produce insulin. Reducing chronic inflammation. Vitamin D has the potential to decrease inflammatory factors in the body, thereby lowering the risk of cardiovascular and neurological complications. Supporting bone health. People with diabetes are often at a higher risk of osteoporosis. Vitamin D helps increase calcium absorption, protecting bone health and reducing the risk of fractures. Sunlight. Our bodies can naturally produce vitamin D when exposed to sunlight. However, exposure time is often insufficient, especially for those living in colder climates or who spend less time outdoors. Vitamin D-rich foods. Fatty fish, salmon, tuna, mackerel, eggs, vitamin D fortified milk, cod liver oil. Vitamin D supplements. Recommended dosage 1,000 to 4,000 IU per day. Vitamin D3. Vitamin D3, cholecalciferol, is the most effective form for increasing and maintaining vitamin D levels in the blood. Excessive vitamin D intake can lead to toxicity, resulting in high blood calcium levels, which may cause fatigue, nausea, and kidney problems. While recommended levels are generally safe, it's advisable to have your vitamin D levels checked regularly. Vitamin D may interact with certain medications, such as diuretics or corticosteroids. Consult your doctor before taking any supplements. A study published in Diabetes, Obesity, and Metabolism suggests that vitamin D supplementation may improve insulin production and blood sugar control. This, in turn, could reduce the risk of complications associated with diabetes. Vitamin D has also been shown to decrease inflammation and improve blood vessel function, potentially lowering the risk of heart disease and nerve damage. Managing blood sugar levels is crucial for individuals with diabetes. This supplement helps improve insulin sensitivity and supports pancreatic function, effectively controlling blood sugar levels. It also helps prevent complications by reducing inflammation, protecting blood vessels and nerves. Additionally, it strengthens overall health by supporting bone health and the immune system. By supplementing with vitamin D, you can not only manage diabetes, but also enhance your overall well-being, leading to a healthier and more fulfilling life. 3. Chromium. Chromium is an essential trace mineral that plays a vital role in supporting insulin function and glucose metabolism. Although only required in small amounts, chromium has a significant impact on blood sugar management, particularly for individuals with diabetes. Chromium plays a vital role in enhancing insulin function by acting as a cofactor, facilitating the efficient transport of glucose from the bloodstream into cells. This process improves the body's utilization of sugar. Chromium supplementation can also enhance insulin sensitivity, reducing insulin resistance and enabling the body to respond better to insulin, leading to improved blood sugar control. By stabilizing blood sugar levels, particularly in individuals with type 2 diabetes, chromium helps minimize fluctuations. Chromium deficiency can lead to several health issues related to blood sugar control. When chromium levels are low, insulin may not function effectively, resulting in glucose accumulating in the bloodstream. This can also contribute to insulin resistance, making it harder for the body to regulate blood sugar levels. Furthermore, prolonged high blood sugar due to chromium deficiency can increase the risk of developing diabetes complications such as nerve damage, cardiovascular disease, and kidney failure. Improving insulin sensitivity. A study published in Diabetes Technology and Therapeutics indicated that chromium supplementation significantly increases insulin sensitivity, leading to more effective blood sugar control. Reducing HbA1c. Research from the Journal of Clinical Pharmacy and Therapeutics suggests that chromium picolinate, the most readily absorbed form of chromium, significantly reduces HbA1c, a measure of average blood sugar levels over 3 months. Lowering fasting blood sugar. Chromium helps lower fasting blood sugar levels, supporting blood sugar balance throughout the day. Supporting cardiovascular health. Chromium may reduce LDL bad cholesterol and triglyceride levels, while increasing HDL good cholesterol, helping to protect cardiovascular health, a common risk for people with diabetes. Good sources of chromium include broccoli, whole grains, poultry, eggs, and mushrooms. Chromium picolinate is the recommended form of chromium supplementation due to its high absorption rate. The recommended daily dosage is 200 to 1,000 milligrams, depending on your health status and chromium deficiency level. While chromium is safe at recommended doses, high doses can potentially harm your kidneys or liver function. Chromium may also interact with medications like insulin or metformin, affecting blood sugar control. Always consult your doctor before taking any supplements. Remember, chromium is a helpful supplement, but it cannot replace essential diabetes management practices like a healthy diet and exercise. Improving blood sugar. A study published in Diabetes Care suggests that chromium supplementation significantly reduces post-meal blood sugar levels and HbA1c in individuals with type 2 diabetes. Reducing cholesterol. Chromium helps regulate blood lipids, lowering the risk of cardiovascular disease. Chromium can help manage blood sugar levels by enhancing insulin function and reducing insulin resistance. It can also improve cardiovascular health by lowering bad cholesterol and raising good cholesterol. Additionally, chromium may help prevent complications by reducing blood sugar and inflammation, thereby protecting blood vessels and vital organs. While chromium is an effective, safe, and easily incorporated supplement for diabetes management, it's crucial to consult with a healthcare professional for personalized guidance and dosage recommendations. 4. Omega-3 Omega-3 fatty acids are polyunsaturated fats that are essential for the body but cannot be produced by the body itself. They consist of three main types: EPA, eicosapentaenoic acid, which helps to fight inflammation; DHA, docosahexaenoic acid, which is crucial for heart health and brain function; and ALA, alpha-linolenic acid, which is commonly found in plants. The body needs to convert ALA into EPA and DHA for use, but this conversion process is not very efficient. Chronic inflammation is a major contributor to diabetes complications, such as cardiovascular disease, nerve damage, and kidney failure. Omega-3 fatty acids, particularly EPA and DHA, act as natural anti-inflammatory agents, helping to reduce inflammation and protect cells. People with diabetes have a 2 to 4 times higher risk of developing cardiovascular disease. Omega-3s can help lower triglyceride levels, reduce blood pressure, and improve blood lipid profiles, reducing the risk of atherosclerosis and cardiovascular complications. Some studies suggest that omega-3s may improve insulin sensitivity and reduce inflammation, thereby aiding in blood sugar control. However, the effects may vary from person to person. Omega-3s help prevent platelet aggregation, reducing the risk of blood clot formation, a dangerous factor for people with diabetes. Omega-3s improve endothelial function, making blood vessels more flexible and healthy, reducing the risk of blood vessel damage caused by high blood sugar. A study published in Diabetes Care found that omega-3 fatty acids can significantly reduce triglyceride levels, a type of fat in the blood that can be dangerous for people with diabetes. Omega-3s also help reduce the risk of death from cardiovascular disease, a common cause of death among people with diabetes. Research from the Journal of Clinical Nutrition indicates that EPA and DHA, two types of omega-3 fatty acids, can reduce inflammation and improve insulin function. To incorporate omega-3 fatty acids into your diet, you have a variety of options. Fatty fish like salmon, tuna, mackerel, and herring are excellent sources of EPA and DHA. Plant-based sources include flax seeds, chia seeds, and walnuts, which are rich in ALA. Vegetable oils such as flaxseed oil and canola oil also provide omega-3s. For a convenient supplement, consider fish oil capsules or algae oil capsules for vegetarians, which provide EPA and DHA. The recommended daily intake of EPA and DHA combined is 1,000 to 3,000 milligrams. When choosing supplements, opt for those certified as pure and mercury-free to avoid heavy metal contamination. Omega-3 fatty acids may have a blood-thinning effect, potentially increasing the risk of bleeding, especially for individuals already taking blood thinners. It's crucial to consult with your doctor before incorporating omega-3 supplements into your routine. While generally safe, high doses above 3,000 milligrams per day may lead to side effects such as stomach pain, diarrhea, or a fishy taste in the mouth. Remember, omega-3 supplements are meant to complement a balanced diet and healthy lifestyle, not replace them. Omega-3 supplements offer a simple yet effective way to support overall health and manage diabetes, particularly when combined with a healthy diet and lifestyle. They can help reduce chronic inflammation, preventing diabetes complications. Additionally, they support cardiovascular health by lowering triglyceride levels, protecting blood vessels, and reducing the risk of atherosclerosis. Omega-3s can also help control blood sugar levels by improving insulin sensitivity, although individual results may vary. Finally, they can help prevent blood clots, reducing the risk of stroke and heart attack. 5. Vitamin E. Vitamin E is a powerful antioxidant that helps protect cells from damage caused by free radicals. This is particularly important for people with diabetes, as high blood sugar levels often generate more free radicals, increasing the risk of inflammation and diabetic complications. Diabetes can lead to increased oxidative stress due to elevated blood sugar levels. Vitamin E helps neutralize free radicals, reducing damage to cells and tissues. It also improves the function of the blood vessel lining, reducing the risk of vascular damage, a major cause of complications such as heart disease and stroke. Chronic inflammation is a key factor in diabetic complications. Vitamin E can reduce inflammation, protecting vital organs like the kidneys, eyes, and nerves. Additionally, it can enhance insulin sensitivity, aiding in better blood sugar control. Vitamin E may also reduce the risk of nerve damage caused by high blood sugar, helping prevent peripheral neuropathy. Oxidative stress increases. When vitamin E is deficient, cells become more vulnerable to damage from free radicals, leading to inflammation and damage to blood vessels. Increased risk of complications. Vitamin E deficiency increases the risk of diabetic complications such as cardiovascular disease, kidney and nerve damage. Poor blood sugar control. Vitamin E deficiency can reduce insulin sensitivity, making blood sugar harder to control. Vitamin E offers numerous health benefits, including improved blood vessel health, reduced inflammation, and organ protection. Studies have shown that vitamin E can enhance blood vessel function, lowering the risk of atherosclerosis and cardiovascular problems. Research published in Diabetes Research and Clinical Practice indicates that vitamin E can decrease inflammatory markers, such as CRP, in individuals with diabetes. Furthermore, vitamin E safeguards the kidneys, eyes, and nervous system from damage caused by oxidative stress and chronic inflammation. By improving insulin sensitivity, vitamin E supplementation can enhance the effectiveness of insulin in regulating blood sugar levels. Food, plants, sunflower seeds, almonds, cashews, vegetable oils, such as sunflower oil, olive oil, greens, spinach, kale, fruits, avocado, kiwi. Supplements, natural form, D-alpha tocopherol is the natural form of vitamin E, which is better absorbed by the body than the synthetic form, DL-alpha tocopherol. Recommended dosage, 200 to 400 IU day. Always consult with your doctor before using. Potential side effects. Taking more than 1,000 IU of vitamin E per day may increase the risk of bleeding problems, especially if you are already taking blood thinners. Long-term use of high doses can lead to vitamin E toxicity and may increase the risk of hemorrhagic stroke. Important note: vitamin E is a supplement and should not be used as a replacement for prescribed medications, dietary changes, or exercise. A study published in the American Journal of Clinical Nutrition suggests that vitamin E supplementation can help reduce oxidative stress and improve blood sugar control. This can lead to a reduced risk of complications, as vitamin E also protects the cardiovascular system, lowers the risk of kidney disease, and helps prevent nerve damage. Vitamin E is a powerful antioxidant that can help reduce cell damage and chronic inflammation. It also supports cardiovascular health by improving blood vessel function and reducing the risk of heart disease. Additionally, vitamin E can enhance insulin sensitivity, aiding in blood sugar control. It also helps protect the nervous system, reducing the risk of nerve damage caused by diabetes. While supplementing with vitamin E can be an effective way to manage diabetes, prevent complications, and improve quality of life, it is crucial to follow recommended dosages and consult with a healthcare professional before starting any new supplement regimen. Now that you are familiar with these 5 essential vitamins, magnesium, vitamin D, chromium, omega-3 fatty acids, and vitamin E, you have the knowledge to actively manage your diabetes. Each vitamin plays a distinct role in regulating blood sugar levels and safeguarding your overall health. Remember, you are in control of your diabetes journey. Start incorporating these simple yet impactful changes into your daily routine today. If you found this information helpful, please give it a thumbs up, subscribe to our channel, and enable notifications to stay updated on more life-enhancing tips. Here's to your well-being. We'll see you in the next video.